Hi everyone, welcome back to MOHIVATE. I'm Dr. Mohi Sarawgee, a GP by profession, but here I'm swapping prescriptions for perspective. It's freezing in the UK, and wherever you're listening from, if winter has found you too, I'm sending you a little warmth, a little heart, and hopefully a little comfort. Winter does something strange to our skin. The days are colder, the sun is shy, the sky is grey, the air is drier, and our skin begins sending dramatic voice notes. In summer, the skin is comparatively cooperative. It has its challenges, yes, but it's softer, calmer, almost loyal. In winter, it wakes up one morning, files for emotional separation, and becomes dry, tight, flaky, itchy, and sometimes red, inflamed, and genuinely painful. For many, this is the season of cracked lips, burning hands, and that shocking moment when your face suddenly stings the moment moisturizer touches it. But if you or your child has eczema, winter can feel like a relentless battle, almost like a full time job. Itchy nights, angry patches, tears at bath time, and somewhere in between, the guilt, the exhaustion, and that question, am I doing something wrong? So today we are pulling back the curtain. We are going to understand winter skin, dryness, barrier repair with a special focus on eczema. And yes, eczema is a wide conversation. It involves genetics, the emotional climate, environment, allergy, and how we care for the skin from day to day. In another episode, we'll explore the bigger picture. But today, we are focusing on just one part of that story: how winter affects eczema and how we can help the skin repair, soothe, and protect itself. And even if you've managed winter skin or eczema for years, I invite you to stay because sometimes it just takes one new insight, one shift, or even one moment of reassurance to make this season feel a little lighter. So, let's begin with your skin barrier itself. Skin is not just a cover, it's the largest organ we have, and its primary job is simple: to protect us, to keep the world out. Healthy skin has a barrier, a beautifully organized layer made mostly of fats like ceramides, cholesterol, and fatty acids. You may have heard this before, but this time let's really imagine it. Think of your skin barrier like a brick wall. The skin cells are the bricks. In between them is the cement made of those protective fats and oils. When the cement is strong, the wall stands firm. Water stays in. Irritants, allergens, and bacteria stay out. But in winter, everything begins to attack that cement. Cold weather slows down the skin's natural oil production, so the cement in our brick wall becomes thinner. Hot showers dissolve those oils even faster, almost like washing butter off warm toast. Dry indoor heating quietly pulls moisture out of the skin, and soaps, especially foaming or scented ones, disrupt the skin's pH, making the barrier even more fragile. So, what helps rebuild the brick wall? Let's start with moisturizers, or as you call them, emollients. Not all emollients work the same. Lotion is light and watery, often not enough in winter. Cream is thicker, great for daily use. Ointment is the richest, ideal for eczema flares or cracked sore skin. Or imagine it this way: lotion is a light blanket, cream is a cozy quilt, and ointment is your winter duvet. Now, here's something really important I want you to understand. You can't fix dry skin by adding water to it. You have to trap water inside it. That's why we recommend moisturizing within 3 minutes of bathing. Right after a bath, the skin is still holding water. If you moisturize quickly, you seal that water in. Dermatologists call it soak and seal. I call it give the skin a drink, then give it a hug. And here's something that shifts everything once you understand it. Let me put it simply. With dry skin, moisturizing helps you feel better. With eczema, moisturizing helps your skin function better. It isn't a beauty step, it's treatment. That's why with eczema, we recommend moisturizing several times a day, sometimes up to 4 to 5 times, using thicker, fragrance free formulations, applying it even when the skin looks okay. Because okay skin in eczema is often skin working very hard just to stay that way. When we stop seeing moisturizing as pampering and start seeing it as barrier protection, our whole perspective shifts. And when it comes to children, moisturizing doesn't have to be a battle, it can become a ritual. Include children in it. Let them apply a little by themselves if they want to. It doesn't need to be perfect, it just needs participation and consistency. I sometimes explain barrier repair to a 5 or 6 year old, and they come back telling me they gave their skin a hug after bath time. Those moments matter and they truly make my day. Because children don't just learn routines, they learn attitudes toward caring for their bodies. They don't just remember the cream, they remember how it felt when someone cared for their skin. Now, let's talk about another big part of barrier repair: how we bathe and cleanse the skin. Bathing should soothe the skin, not strip it. Hot baths on cold nights feel heavenly, but they melt away the oils that protect the skin. So, in winter, remember this: warm is soothing, hot is stripping. For children, 5 to 7 minutes is usually enough. Long soaking baths can actually make the skin drier unless moisturizer is applied immediately afterwards. So, how do we choose the right cleanser? Most soaps and bubble baths, even the mild ones, can raise the skin's pH, strip away protective oils, and worsen eczema. So, look for cleansers that are soap free, fragrance free, pH balanced, suitable for sensitive or eczema prone skin. You don't need bubbles or perfume for skin to be clean. And for babies, plain warm water often cleans better than soap. So, once bath time is over, pat the skin dry. Don't rub. Leave it slightly damp. Moisturize within 3 minutes. Seal the hydration in. I often hear, but I do moisturize. It just doesn't work. Often, it's not the cream, it's the timing. And something most people don't realize is that we usually don't use enough emollient. Emollients should be thick, fragrance free, used generously, used every single day, not just during flares. A healthy skin should look comfortable, nourished, slightly glossy, not tight, dull, or thirsty. And if your 500 ml tub of emollient is lasting 2 to 3 months, it's almost always underuse. In moderate to severe eczema, that same tub may last just 2 to 3 weeks. People are always surprised when we tell them that, but that is exactly what thirsty, healing skin needs. Bath oils can help add hydration, but just be careful no one ends up sliding around like a penguin on tiles. And before we move ahead, a quick word on natural oils. Coconut, almond, olive, mustard oils, they feel comforting and familiar, but medically, we don't routinely recommend them. Some can irritate eczema prone skin, and some can even increase the risk of developing food allergies. So we stay with products that are evidence based, stable, and safe. Now that we've cared for dryness and protection, and you understand why doctors keep emphasizing moisturization, let's talk about what to do when eczema flares, when moisturizer alone is not enough, and how to treat it without fear. I'm talking about steroid creams. We've all heard things like you'll thin the skin, never use it on children, natural is always safer. I hear these almost every day. But let's put it simply. When the skin is inflamed, cracked, hot, red, and itching relentlessly, it needs more than moisturizer. At that stage, the barrier is already damaged and it cannot repair itself without help. That's when we use steroid creams, not as a last resort, but to calm the inflammation so the skin can begin to heal again. So, to answer your question, are steroid creams safe? Yes, when used correctly, in short, guided bursts, and under medical supervision, they are safe, effective, and often necessary. The bigger risk is not using them when they are needed because undertreated eczema stays broken, sore, and itchy, making it more vulnerable to infection, pain, bleeding, and sleep loss. Mild steroid creams like hydrocortisone 1% can be purchased over the counter in many countries, even in the UK. But even with those, it's always wise to get guidance. Anything stronger should only be prescribed by someone who understands your skin or your child's skin and the particular pattern of your eczema. Remember this, wherever you hear the word steroid, there should be a healthcare professional involved, someone who guides, explains, and gives you a proper plan. One tool that really helps people use steroids safely is something called a fingertip unit or FTU. If you've never heard it before, hear it now. It simply means the amount of cream squeezed from the tip of an adult finger to the first crease. That amount is enough to cover an area of skin about the size of two adult palms. Most people underuse steroid creams, not because they don't care, but because they are afraid of using too much. Understanding fingertip units takes away that fear and replaces it with clarity and confidence. Eczema flares don't always stay dry or itchy. Sometimes they become infected simply because the barrier was already weakened. Signs to gently watch for: yellow or golden crusts, oozing or wet looking patches, skin that looks shiny, hot, or unusually inflamed, pain or tenderness. Remember, eczema usually itches. Painful eczema may be infected. Rapid spreading of redness, and in children, fever, tiredness, or just being unusually irritable. If any of these appear, you don't need to panic. You don't need to Google it at midnight. You simply need guidance. Sometimes we prescribe an antimicrobial cream, sometimes an antibiotic, and sometimes we adjust the steroid plan. Here's something I really want you to remember: steroid creams do not cause infection. Untreated, broken eczema does. Using the right treatment at the right time actually reduces infection risk because it restores the skin barrier. So, when you're unsure, please ask. Ask your GP, prescribing nurse, dermatologist. No cream should feel mysterious or frightening. When you understand what it does, you use it correctly and confidently. Now that we've looked at moisturizers, cleansing, bathing, and treatment, let's move into something many of us often ignore: heating. Central heating makes our homes warm and cozy, but it also turns them into giant hair dryers. The warmer the air, the less moisture it can hold. And that dry indoor air quietly pulls water from the skin all night long. A humidifier, especially in the bedroom, can help reduce overnight water loss and stop that tight, itchy, dry morning skin feeling. And if you don't have a humidifier, don't worry. A simple bowl of water near the radiator or even drying laundry indoors can gently increase moisture in the air. Just one request, don't blame me if your house starts growing mysterious indoor plants called mold. Skin loves moisture, walls don't. So keep your home ventilated from time to time. Now, clothing. Skin that is sensitive, dry, or inflamed doesn't like friction, heat, or scratchy fabrics. Whenever possible, choose cotton over wool, fleece, or polyester. Use a soft cotton layer under sweaters. Avoid tight cuffs on irritated areas. Think breathable, not just warm. Often, we overbundle children in winter, especially at bedtime, but heat actually increases itching. Itching often becomes worse at night. Why? Partly because body temperature rises slightly before sleep, partly because cortisol, our natural anti inflammatory hormone, drops, and partly because there are no daytime distractions. Things that may help: a cooler, airy bedroom, cotton sleepwear, trim nails or mittens for little ones, short term antihistamines only if age appropriate and prescribed, not as eczema treatment, but sometimes simply to help with sleep. Because itchy nights affect the whole family, not just the skin. A quick note on wet wraps. You may have seen wet wraps online, layering moisturizer, using damp bandages, then a dry layer. They can help in some severe cases, but only when they are explained and guided by a healthcare professional. When used incorrectly, they can trap bacteria, irritate the skin, or even cause infection. This is not fear, this is care done carefully. A brief word on probiotics. Food, gut health, and allergy in eczema deserve their own episode. But a quick note: some early research suggests that certain probiotic strains, particularly Lactobacillus rhamnosus GG, may help reduce eczema severity in some children, mainly when used preventatively in pregnancy and infancy. But the effect is small. It does not replace skincare. It's not a treatment for eczema. And regular yogurt, kefir, or shop bought probiotic drinks are not the same as medical grade strains used in studies. They may support gut health, but they cannot repair the skin barrier. That work still depends on moisturizers, correct steroid use when needed, and consistent, gentle care. Now, there's something I want you to understand. Eczema doesn't only live on the surface, it lives in a family's evenings, in sleep, in the quiet worries, in the way the itch gets louder when emotions are loud. Stress inflammation is real. Cortisol, adrenaline, exhaustion all affect the immune system and the skin barrier. Children don't need perfect homes to heal. Nobody's home is perfect, but healing does ask for calm consistency and everyone's emotional regulation more than frantic fixes. Children may not remember every cream, every bath, or every bandage, but they do remember how it felt when someone cared for their skin with patience. We don't just remember treatment, we remember the warmth. We often talk a lot about DNA, the blueprint, the plan, but it also has a quieter sibling, RNA. It doesn't just carry instructions, it listens, It responds, it bends, folds, reshapes itself into whatever the cell needs in that moment to protect, to repair, to rebuild, to recover. Skin is a bit like that too. It doesn't respond to potential, not to promises, not to pretty packaging. It responds to what is proven, nourishing, protective, to ingredients that repair, to rituals that are repeated, to consistency, to care. And people can be a bit like that too. Some are drawn to the maybe or the might be, and some wait for what is true, what earns its place through clarity, presence, evidence, outcomes, what actually heals. There's something quietly grounding in that kind of wisdom. So, if you take one thing from today, let it be this. In winter, your skin isn't failing, it's asking. And when we support it patiently, consistently, kindly, it often learns how to protect us again. I hope something today stirred a thought or simply made you feel a little less alone. Thank you for listening. I'm Dr. Mohi. Until next time, stay motivated. May this winter feel softer on your skin, and may you always find your way back to the quiet wisdom of the body you call home.